According to the CDC, as many as 61 million Americans live with some form of a disability, and we can expect that number to rise by at least 7 to 23 million people. That's an estimate of how many Americans suffer from long COVID, according to the U.S. Government Accountability Office. It is an absolutely terrifying data point because it shows that COVID is not going to go away anytime soon. In fact, COVID could be around for another whole generation and maybe even longer than that. Joining me now, Diana Barrett, founder of the long hauler advocacy group, Survivor Corps, and Mia Ives Rublee, director of the Disability Justice Initiative at the Center for American Progress. I'm so grateful to both of you for being here for this really, really important, essential conversation. Diana, I will start with you. You told the Washington Post that there were some resentments and tension within the disability community when COVID long haulers saw money flowing in, research dollars, into their community, but people who share similar long-term chronic symptoms did not. I mean, help us understand the challenges going on right now in your community when it comes to accessing resources with an influx of long-haul COVID patients and Americans suffering from long-term symptoms.
Yeah, this is, it's a thorny issue because, there are so many different chronic disease communities who have been largely ignored, underfunded, with no sense of urgency. I mean, think of ME/CFS, fibromyalgia, Lyme disease. And also keep in mind, we can't ignore the fact that a lot of these autoimmune diseases, chronic diseases, affect more women than they do men. In the same way with long COVID, we don't know the actual rates with long COVID, but it looks like it could be 60%, 70% women. And, it has long been a modern day diagnosis of female hysteria. And just the numbers right now are demanding attention. It's demanding urgency. But the driving principle needs to be that every community moves forward together. Because with all of this funding, and we need to make sure that this funding is being spent properly, and I don't think it is right now, but everything that we learn about long COVID, we need to make sure benefits every other one of these communities, because I don't blame people saying, we've been ignored for all this time, and then you guys show up. And all of a sudden there's money, there's attention, and there is because of the sheer numbers, but it's everyone's responsibility to make sure that every group benefits from this sort of investment in this research and this advancement.
It's such an important point, and Mia, I've been thinking a lot about this since the beginning of the pandemic because I pay attention closely to the conversation happening on Twitter with advocates in the disability space. And at the beginning of the pandemic, there was a lot of conversation around how, only those with pre-existing, comorbidities are going to be severely impacted by COVID, which basically sort of like wrote off anybody in the disability space as like expendable. I mean, that was sort of the framing at the beginning of the pandemic. And in a lot of ways, the folks in that community were warning of exactly what we're seeing now, which is a lot of people with chronic conditions without the resources. So speak to some of the structural inequalities that exist for people with disabilities that predated the pandemic, but that also are coming to the forefront right now.
Yeah, well, thank you again for having me on. I think one thing that people don't realize is that the disability community takes up a big portion of the United States. So 1 in 4 individuals, according to the CDC, have a disability, and that's without counting the increase in folks who have long COVID joining the community. And the problem has been that the disability community has been discounted because it's been seen as a community that needs to be taken care of, but not actually given the same rights and opportunities as the general population. So we've really been shortchanging the community in terms of resources, particularly when looking at some of the hardest hit communities, including Black and Brown communities, low income communities, service workers, et cetera. All of those communities have seen significant losses due to COVID, but then also higher rates of long COVID because just so many more of those individuals have gotten COVID. So, really looking at the inequities in terms of resources that are put into the disability community, we need to really restructure things.
In terms of, this idea, as I mentioned, that at the beginning of the pandemic, Mia, the framing really was that, the most vulnerable people are seriously at risk for COVID, but, that's okay. That's somehow, okay. And we don't have to really worry about that. I mean, do you think that the disability community, has been an afterthought? And how important do you think it is that we shift that dynamic, given the fact that this, is shaping up to be a long-term problem that the next generation of Americans are going to have to deal with it, whether they like it or not?
Yeah, most definitely. I think it's been very obvious that the disability community has been an afterthought. I think you look at any of the debates around vaccines to things like masks, the fact that the CDC reordered its classifications in terms of community spread and community levels has shown a real lack of concern about individuals who are particularly susceptible to getting COVID and having detrimental effects. And the interesting thing about it is that as we're creating more individuals with chronic disabilities like long COVID, we are actually creating more people who are going to be seen as expendable. And I think one of the things that people aren't realizing is that, we hear all the time about the fact that we don't have enough employees that want to work in this current economy right now, and that people are leaving their jobs to look for new opportunities. You look at the disability community, which is 2 times unemployed, 2 times as much as non-disabled people. You look up and down the board of all of the different regulations and policies, and it shows a real lack of just forethought in terms of thinking about the disability community. And it's sort of just like this untapped pool of individuals that are ignored and then sort of seen as expendable.
So important. And Diana, last question in the last minute here. Biden did announce efforts to combat long COVID earlier this year. Have long haulers actually seen any change in their care since that time?
Unfortunately, no. And, I was a big, fan of the Biden announcement. That said, without the money, it's not going to happen. It's all about the Benjamins here. We need funding immediately, and not necessarily putting good money after bad money with the NIH, but we need immediate funding for clinical trials to happen, starting now, starting yesterday. People are suffering, and we are looking, this is the largest mass disabling event in our nation's history, wartime included. And we need to view it with that kind of urgency and, there's no 2 ways about this. This is going to change the fabric of our society, and we need to prepare ourselves for it and be able to accommodate the masses of people who are going to need that support structure financially, in employment, physically, health access. There is no part of our society that is not going to be touched by long COVID.
Absolutely. Thank you so much, Diana and Mia, for being here today. Such an important conversation. I want to continue to have it as this situation unfolds and persists. And hopefully we'll get to a point where people want to put on a mask so we don't create a situation where more people are contracting COVID and having these long haul symptoms. Thank you both for being here. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.